Hi, I'm Phil. I'm the National Director of Recruiting. I am in the healthcare staffing and technology field, and I would rate OnCall Health Platform a 3 out of 5. When I was looking for different solutions, I tried different ones and I was reached out to several different companies. And OnCall Health Platform actually reached out to me first and were the ones that gave me the best deal for the trial period. I did not try any other software related to OnCall, uh, but they're the ones that actually had a great response rate on getting back to me. Um, but we didn't unfortunately try any other solutions. We actually have been working with Google and for Google Meet for an alternative solution. I chose OnCall because, well, one, they were the first ones to actually reach back out to me after asking for a demo from several different companies. They were very responsive, very friendly. They gave me a very professional demonstration of the product, and their pricing actually was not that bad. And so I felt for the value of what I was getting for that temporary trial period was in line with what I can spend. Unfortunately, the onboarding with our particular software and our talent pool was a little bit difficult. OnCall, unfortunately, was a newer software, so it could not integrate with our applicant tracking system or our systems. Um, and then when our talent pool tried to use it, um, they unfortunately were not able to figure it out. The app did keep crashing a lot on the more of the cheaper and older Android devices. And that's the majority of our talent pool that uses those for the services. It did decently well on newer model iPhones, but when it came to the majority of the talent pool, the onboarding for them to actually get into using it and teaching our staff, it ended up being very difficult to use. OnCall has got a great customer service base. I spoke directly with a couple of their VPs directly, and so when you're dealing with them, they are going to do everything above and beyond to try to help you. The problem is we are a very large company with a very high volume number of talent pool and applicants that we deal with on a daily basis. And unfortunately, the majority of our talent pool do use older devices and more less, I guess, less affordable Android devices. The software didn't really work well on those devices. So my encouragement for you or my advice is if you are going to use this service, make sure that the end users are both more of the high acuity level, higher acuity level, I would say. So if somebody was using more of advanced devices, people who are very tech savvy need to be able to figure out something like this type of software, where it's easy, where you have to actually go through a web browser to use it, and you have to be not download software and be able to log on at a certain time and join a waiting room and know how to navigate that without instruction. Unfortunately, in the beginning with our dealings with OnCall, we tried our best to try to guide our talent pool into using that. So, and they just weren't used to doing that. So my extended advice would be to you is if you're going to use this, make sure it's more of advanced users that are a little bit more tech savvy than the average person.